Borderline personality disorder, or BPD. Imagine living in constant emotional turmoil, where your mood can change like a flip of a switch. You feel empty and alone, even when surrounded by people who love you. Your relationships are turbulent, and even the smallest of arguments can escalate into a full-blown crisis. These are just some of the experiences that people with borderline personality disorder go through every day. BPD is one of the most painful and hurtful mental disorders in the world that makes the person feel unloved, unwanted, and unworthy. It can stem from a history of emotional, physical, or sexual abuse, neglect, or growing up in a dysfunctional family. Symptoms of BPD include unstable relationships, intense mood swings, impulsivity, and a fear of abandonment. Sometimes people with BPD may also struggle with self-harm or suicidal thoughts due to their intense emotional distress. PTSD, or post-traumatic stress disorder. It's been 6 months since you came out of a coma after surviving a car accident that took the life of your best friend. After what feels like a lifetime of hospital beds and rehab sessions, you are finally back home. But things are not the same anymore. The very thought of jumping into a car makes your skin crawl. It's like your brain is stuck in a loop, replaying the crash in slow motion. Any sound or smell that reminds you of that moment sends you into a panic. This is what living with PTSD feels like. But PTSD doesn't just occur unexpectedly. This mental disorder starts after experiencing or witnessing a traumatic event, like war, assault, natural disaster, or accident. It can be initiated anytime you hear, see, or even smell anything connected to that scene. Symptoms of PTSD include fear, rapid breathing, sweating, and sometimes flashbacks. Bipolar disorder. If you've ever been on a roller coaster, you might know what it feels like to have bipolar disorder, except this ride isn't an exciting one. It's like having two different people living inside you, constantly fighting for control. During the manic phase, you feel like you can conquer the world with endless energy and racing thoughts. But then, without any kind of warning, you crash into a deep depression, where you feel hopeless, tired, and sad all the time. This cycling between extreme highs and lows is a hallmark of bipolar disorder. It is a mood disorder that affects more than 5 million people around the world. While the exact cause is still not fully understood, some scientists believe it may be a combination of genetic, environmental, and brain chemistry factors. Depressive disorder. Having depression is like living in a world without colors. Every single day feels like a Monday, and there's no end in sight. It's not just being sad for a while or having a bad day. It's a constant feeling of emptiness and hopelessness that makes you lose interest in everything. You might find yourself sleeping too much or not at all, eating excessively or barely eating anything, and having difficulty concentrating on even the simplest tasks. Depression is a mental disorder that affects millions of people worldwide and is often caused by a combination of genetic, biological, environmental, and psychological factors. If the person with depression doesn't seek help, it can lead to serious or life-threatening consequences, including self-harm and drug or alcohol abuse. Schizophrenia. As a child, it's normal to have an imaginary friend that only you can see and talk to. But for someone with schizophrenia, that imaginary friend can feel very real. It's like they're living in a world where delusions and hallucinations are just as vivid as their everyday lives. Schizophrenia is a severe mental disorder that affects about 1 in every 300 people, often starting in early adulthood. People with schizophrenia may have difficulty distinguishing between what's real and what's not, leading to disorganized thoughts and actions. They may also experience changes in behavior and emotions, including feelings of paranoia and fear. While there is no cure for schizophrenia, early diagnosis, therapy, and medication can help manage symptoms and improve the person's quality of life. Eating disorder. An eating disorder is like having a monster living inside your head, constantly telling you that you're not good enough. It's an unhealthy obsession with food and weight that can take over someone's life. There are several types of eating disorders, including anorexia nervosa, bulimia nervosa, and binge eating disorder. All of them can have severe consequences on a person's mental and physical health if left untreated. Eating disorders are often linked to low self-esteem, body image issues, and a desire for control. In the United States alone, over 14 million people suffer from eating disorders, leading to serious health problems like heart disease and kidney failure. Anxiety disorder. Anxiety is that gut-wrenching, sweat-drenched sensation of fear and unease that seems as unpredictable as a sudden storm. With an anxiety disorder, you might feel like you're always on edge, constantly worrying about the future and feeling powerless to stop it. While some anxiety is normal and even helpful, it can become a disorder when it interferes with daily life. Anxiety disorders can range from generalized disorders to specific phobias, panic disorders, and social anxiety disorders. This mental illness impacts about 301 million people globally, but they don't have to dictate your life. Medications, relaxation techniques, and cognitive therapy can help you lead a more fulfilling and anxiety-free life. Obsessive-compulsive disorder, or OCD. Imagine having a nagging voice in your head telling you that something terrible will happen if you don't perform a specific action. You might feel compelled to check the locks repeatedly, wash your hands until they're raw, or count objects over and over again. These are just some of the many compulsions that can come with obsessive-compulsive disorder. It's a mental disorder that causes unwanted and intrusive thoughts, leading to repetitive behaviors to alleviate anxiety. OCD is pretty common, affecting about 79 million people around the world, but cognitive behavioral therapy can help manage symptoms and improve the person's quality of life. Autism spectrum disorder. People with ASD often feel like they're on a whole different planet from everyone else. This neurological condition affects how people communicate, interact with others, and perceive the world. Social interactions, making eye contact and grasping humor, can be difficult for individuals on the spectrum. However, they often possess intense passions or remarkable talents in particular fields. While there is no cure for ASD, early intervention with therapies like speech and occupational therapy can help improve communication skills and social interactions. It's essential to create a supportive environment that celebrates the unique strengths of individuals with ASD and helps them navigate through everyday challenges. Attention deficit. Hyperactivity disorder. ADHD is like having an overactive mind that never seems to slow down, no matter how hard you try. It's a neurodevelopmental disorder that affects the way the brain processes information and regulates behavior. People with ADH may have trouble focusing on tasks, sitting still for extended periods, and controlling their impulses. No matter how much they may want to concentrate or complete a task, their brain is always buzzing with distracting thoughts. From inattentive to hyperactive impulsive, there are many subtypes of ADHD, and it can affect anyone at any age. Sleep disorder. Sleep is essential for our physical and mental health, but for someone with a sleep disorder, getting a restful nap can feel like an elusive dream. Nearly half of the world's population suffers from some form of sleep disorder, with insomnia being one of the most common. If you have insomnia, no matter how tired you are, falling asleep is a constant struggle. Other sleep disorders include sleep apnea, restless legs syndrome, and narcolepsy, all of which can have a significant impact on a person's daily life. Seeking treatment, such as therapy and medication, can help manage symptoms and improve sleep quality.